Welcome to the deep dive. If you're tuning in, you're probably right in the middle of that amazing and, let's be real, sometimes pretty overwhelming milestone. Introducing solid foods.
Oh, absolutely. It's a
Okay.
huge step, and there's just so much advice flying around, isn't there? Friends, family, the internet.
Exactly. Which is why we dove in. We've basically spent time digging through, well, all sorts of things. Baby food blogs with homemade recipes.
The allergy prevention guidelines, which are super important.
Right. And advice from pediatricians, feeding experts, you name it.
And our goal really is to cut through the noise. We want to give you the most crucial, actionable stuff, specifically if you're doing this for the first time, a shortcut to feeling informed but not swamped.
Yeah, totally. So we're going to cover the big questions like when is my baby actually ready? How do I introduce foods, especially those scary sounding allergens?
And of course, the inevitable topic of poop changes.
Ah, yes. Can't avoid that one. And we'll touch on the different ways to feed purees, baby-led weaning, all that jazz. But keeping it practical, like what can you actually do?
Those aha moments, right?
Exactly. Okay, so let's jump in. The absolute first question on every new mom's mind, when? When do we even start thinking about solids?
So the general guideline you'll see everywhere is around 6 months. That's the main
Yeah,
recommendation.
sounds okay.
But, and this is important, it's not a magic number carved in stone,
Mm-hmm.
and definitely not before 4 months.
Right. Why not earlier? What's the risk?
Well, their little digestive systems just aren't quite mature enough before 4 months. Starting too early can lead to things like tummy upset, maybe constipation. They're really designed for milk, breast milk, or formula at that point.
Okay, that makes sense. Wait until their bodies are a bit more ready. But how do you know if your specific baby is ready around that 6 month mark? Are there signs?
Yes, definitely. There are key developmental signs to watch for. Probably the biggest one is the loss of the tongue thrust reflex.
Ugh, yeah. That thing where they just push everything out with their tongue.
Exactly.
Yeah.
If you try to put something solidish in their mouth early on, they automatically push it right back out. That needs to fade so they can actually, manage food in their mouth.
Okay, so less tongue thrusting. What else?
They really need to be able to sit up well, pretty much independently, or with minimal support. That shows they have the core strength needed for safe swallowing.
Right. Posture matters for eating. Makes sense.
And then there's the interest factor. Are they watching you eat? Maybe reaching for your
Oh,
food?
yeah, the grabby face.
Or even just being able to pick up objects like a toy and bring it accurately to their mouth? That coordination is a good sign too. It all points towards readiness.
Okay, so we're looking for sitting up well, lost the tongue thrust, and showing real interest. Got it. So let's say we're seeing those signs, baby's around 6 months. What do we actually give them? That first spoonful feels momentous.
It does. And the good news is you have options. It doesn't have to be one specific thing. You could do homemade purees, store-bought purees. It's flexible.
So no pressure to pick the perfect first food.
Not really. The sources we looked at mentioned lots of great starters.
Yeah.
Think smooth, single-ingredient purees, things like mango, banana tails. Those are often popular.
Sweet ones.
Yeah, but also things like pureed chicken, turkey, beef for iron, and veggies like peas or sweet potatoes. And baby cereal is an option too.
Right, baby cereal. I see rice cereal pushed a lot. Any thoughts on that?
Well, yeah, that came up. There have been some concerns about arsenic levels in rice products, so many experts now lean towards recommending oatmeal over rice cereal, especially initially.
Oh, interesting. Good to know. Oatmeal it is, maybe?
But again, variety is good down the line. The absolute key for the very first foods, though, is single ingredient purees.
Why single?
It just makes it so much easier to pinpoint any potential reaction or sensitivity. If you give them the blend of three things and they get a rash, you have no idea which one caused it, right?
Ah, okay. Keep it simple to start. Makes total sense. And how much are we talking? Like a whole jar? I can't imagine.
Oh gosh, no. Tiny amounts. Start really small, like
Yeah.
1 or 2 teaspoons, once a day.
Teaspoons. Okay.
Yeah. Then you just watch your baby. If they seem keen, opening their mouth for more, you can gradually increase it over time, maybe up to 1 or 2 tablespoons per meal eventually.
But follow their lead.
Absolutely. Follow their cues. If they clamp their mouth shut, turn their head away, start fussing, they're done. Don't force it. Mealtime should be positive.
Right, no pressure. What about the texture? Super smooth, right? Like liquid?
Pretty much, yeah. For those very first tastes, think really smooth, almost soupy. As they get the hang of it over weeks and months, you can gradually make it a little thicker, maybe introduce some soft, tiny lumps. It helps them learn to manage different textures.
Okay. And if I'm making my own purees, any tips for getting that smooth texture or storing it?
Sure, if it seems too thick, you can easily thin it down with a bit of water or even formula or express breast milk.
Ah, okay. Use their usual milk.
Yep. And for blending, sometimes it helps to have at least, say, a cup of the ingredient in the blender to get it really smooth. For storing extras, ice cube trays are brilliant.
Oh, yeah, I've heard that one.
Silicone ones are great because the frozen cubes pop out easier, and some people prefer them over plastic.
Mm.
Freeze the puree in cubes, then pop them into a labeled freezer bag. They're good for about 3 months.
Super practical. 3 months. That's handy.
Then just thaw a cube or two overnight in the fridge when you need it. Easy.
What if something tastes bland or maybe too sour, like some fruits? Can you sweeten it a bit?
You can definitely adjust. If a fruit puree, like maybe berries, seems a bit tart, mixing in a little naturally sweet puree like banana or avocado, or even some apple or sweet potato puree can help balance it out.
Good idea. Mix and match.
Just a couple of quick don'ts that came up. Avoid putting cereal in a bottle. It's a choking hazard and can lead to overfeeding. Unless, of course, a doctor specifically advises it for reflux or something.
Right. No cereal in bottles.
Got it. And hold off on juice for babies under 1 year old. It's mostly sugar, not much nutrition, and can cause tummy issues or even affect their teeth later on. Water and their usual milk are the best drinks.
Okay, super clear. No juice, no bottle cereal. Now, the big one, allergies. This feels like the part that freaks new parents out the most, myself included potentially.
It's totally understandable. It feels like high stakes, doesn't it? But actually, the advice has shifted quite significantly in recent years.
How so? I thought we were supposed to wait on things like peanuts and eggs.
That used to be the thinking. But now, the expert consensus, based on research, is that we should actually be introducing common allergy-causing foods early, generally between 6 and 12 months.
Really? Introduce them early.
Yes. The idea is that introducing these foods early and regularly in an age-appropriate form might actually help the baby's immune system learn to tolerate them, potentially reducing the risk of developing an allergy, especially for babies at higher risk, like those with severe eczema or an existing egg allergy.
Wow, okay. That's a total flip from the old advice.
Yeah.
So what foods are we talking about? The common allergens.
Exactly. The main ones are egg needs to be well cooked, like scrambled or hard-boiled and mashed. Peanut smooth, peanut butter or paste, never whole nuts or chunky butter.
Smooth peanut butter. Okay.
Cow's milk, so dairy products like yogurt or cheese. Tree nuts, again as a smooth paste like almond or cashew butter. Soy, things like tofu or soy yogurt. Sesame, often as tahini. Wheat, fish, and other seafood like shellfish.
That's quite a list. How on earth do you introduce all of those safely?
Slowly and steadily. The absolute golden rule is introduce only one new common allergen at a time. At each meal, just one.
Okay, one at a time. Why?
So if there is a reaction, you know exactly what caused it. Imagine giving peanut and egg for the first time together, and your baby reacts. You wouldn't know which one was the culprit.
Right, makes sense. Process of elimination. How much do you give?
Start really small, like a quarter of a teaspoon, maybe even less. Mix into a food you already know your baby tolerates well, like some plain yogurt or fruit puree.
Just a tiny bit mixed in.
Yep. Some guidelines suggest you can even rub a tiny bit on the inside of their lip first. Wait a few minutes, see if there's any immediate redness or swelling there. If not, proceed with a small taste.
Okay. And definitely don't rub it on their skin, right? I've heard people suggest that.
No, definitely not. Smearing food on the skin is not a reliable way to test for allergies and could potentially even increase the risk of sensitization through the skin. So, stick to oral introduction.
Got it. So, tiny taste, one allergen at a time. What happens next, assuming no reaction?
If everything looks fine after that first small taste, the next step, maybe a day or two later, is to offer a slightly larger amount, perhaps half a teaspoon or a full teaspoon.
Gradually increase.
Exactly.
Yeah.
And then this is crucial. Once you've introduced it and confirmed there's no reaction, you need to keep offering that food regularly, like maybe twice a week.
Oh, okay. So just introducing it once isn't enough.
No. Consistency is key for building tolerance. Introducing it once and then avoiding it for months might actually increase the risk later. So keep it in the rotation, maybe twice a week, as part of their normal varied diet.
Right. Introduce and include. What are we actually looking for in terms of a reaction? What are the warning signs?
You're looking for things that happen relatively quickly, usually within minutes, but up to maybe 2 hours after eating the new food. Signs include hives, those red raised, itchy welts on the skin,
Okay, hives.
swelling, especially around the lips, eyes, or face,
Hmm.
vomiting or diarrhea soon after eating, maybe sudden fussiness, or they become unusually sleepy or floppy.
Anything else? More serious signs.
Yes. Difficulty breathing, wheezing, noisy breathing, a persistent cough or swelling of the tongue, those are signs of a potentially severe reaction, anaphylaxis, and need immediate emergency medical help. Call 911 or your local emergency number straight away.
Okay, that's really important to know. Breathing issues, tongue swelling, immediate emergency.
Absolutely. For milder reactions like just hives or vomiting, stop feeding the food and contact your pediatrician or healthcare provider for advice.
What about just a bit of redness around the mouth? Is that always an allergy?
Not necessarily. Sometimes, particularly with acidic foods like tomatoes or citrus, you might see some mild redness just where the food touched the skin. That's often just skin irritation, not a true allergy. But if you're unsure, always best to check with your doctor.
That's helpful. So mild redness might just be irritation. Okay, this allergy stuff feels a bit less terrifying now with a clear plan. Introduce early, one at a time, small amounts, increase gradually, keep offering regularly, and note the signs.
Exactly. And always talk to your doctor if you have concerns, especially if there's a family history of allergies or if your baby has eczema.
Perfect. Okay, let's switch gears a bit. Feeding methods. I hear baby-led weaning or BLW thrown around all the time, alongside traditional purees. What's the difference, basically?
So traditional puree feeding is probably what most people picture. You spoon feed the baby smooth, mashed foods. You're kind of in control of getting the food into their mouth.
Right, spoon feeding.
Baby-led weaning, or BLW, is different. You skip the purees, or mostly skip them, and offer baby soft, graspable pieces of whole foods right from the start around 6 months when they show those readiness signs we talked about.
So they feed themselves.
Exactly. You put the food on their tray or plate, think steamed broccoli florets, strips of soft-cooked sweet potato, pieces of banana, and they pick it up and bring it to their own mouth. They control what they eat, how much, and how quickly.
Interesting. What are the supposed benefits of letting them feed themselves like that?
Well, proponents say it can save time and money because baby often eats modified versions of what the family eats. It's great for developing their motor skills, grasping, chewing, hand-eye coordination.
I can see that.
Many believe it encourages better acceptance of different textures early on, which might potentially lead to less picky eating down the road. And it lets them join in family mealtimes from day one, which is nice.
Less picky eating sounds like a dream. Are there downsides to BLW?
There are definitely things to consider. Number one is mess. It can be incredibly messy, especially at first. Food everywhere.
Ah, I believe it.
There can also be more food waste initially as they're learning and exploring more than actually consuming large amounts. And a big one for some parents is the worry about how much they're actually eating. It's harder to quantify compared to spoon feeding.
Yeah, that makes sense. You can't see exactly how many spoonfuls went in. What about choking? Is that more of a risk with BLW?
That's a common concern. Actually, studies suggest that when done correctly, offering appropriately sized and textured soft foods, ensuring baby is sitting upright, the risk of choking isn't necessarily higher with BLW compared to purees. Gagging is common and normal as they learn, but choking is different. It's crucial to know the difference and always supervise closely.
Okay, so gagging is normal, choking is the danger. Supervision is key. What about purees then? What are the pros and cons there?
With purees, the big pro is that you know exactly how much food they've eaten. It can feel more controlled.
Right, reassuring for some parents.
The cons are that it can be time-consuming if you're making them all yourself, or more expensive if you're buying pre-made jars and pouches. Baby gets less practice with self-feeding skills early on, and you eventually have to make the transition to more textured table foods anyway.
So it sounds like neither way is definitively better.
Pretty much. There's no single right way. Many families actually end up doing a combination approach. Maybe purees sometimes, finger foods other times.
Oh, you can mix match.
Absolutely. Or you might start with purees for a few weeks
Yeah.
and then start introducing soft finger foods alongside them as baby gets more confident. It's flexible.
That's good to know. Takes the pressure off choosing one camp.
Yeah, the goal really, regardless of how you start, is that by around 9 months or so, most babies should be managing a good variety of soft, chopped table foods.
Okay, 9 months is a rough guide for handling table food. Great. Now, let's talk about diapers again. What actually happens to baby's poop when solids start? I brace myself for change.
Yes. Brace yourself. Things will change. Expect shifts in color, frequency, texture, and definitely the smell.
Okay, lay it on me. Frequency first.
Yeah, might actually find they poop less often than when they were exclusively on milk. Solids add bulk, and sometimes they absorb more fluid from the solids.
Less often. Okay, that's surprising.
Yeah, the range considered normal is really wide. Some babies still go multiple times a day, others might only go every few days. As long as the poop is soft and they're comfortable, the frequency itself isn't usually a worry. Consistency is more important.
Right. So what happens to the consistency?
It'll definitely get firmer, more formed, think less liquidy, more paste-like, or even like soft logs eventually. It reflects the fiber and protein they're now eating.
Makes sense. And the smell.
Oh, the smell will become noticeably stronger, more like, well, adult poop. Say goodbye to those relatively mild milky diaper smells.
Farewell, sweet milky poops. Okay, color. This is where it gets interesting, right? What's normal?
Normal can be a whole spectrum. Yellow, brown, green are all common. Dark green can happen after eating green veggies like spinach or peas, or sometimes from iron supplements or iron-fortified foods.
Green is okay then. Phew.
Yep. You might even see tinges of other colors depending on what they ate, like reddish hues after beets or even bluish after blueberries.
Blue poop. Okay, noted. Don't panic. Are there any colors that should make me panic, or at least call the doctor?
Yes. Red as a concern could indicate bleeding. Black, especially if it's terry looking, could also signal bleeding higher up in the digestive tract and needs checking out. And white, gray, or very pale yellow poop could indicate a liver or gallbladder issue and warrants immediate medical attention.
Red, black, white, gray, pale, yellow, call the doctor. Got it. What about constipation? How do I know if it's actual constipation versus just less frequent pooping?
Good question. Constipation isn't just about frequency. It's about the consistency and difficulty passing the poop. You're looking for hard, dry, pebble-like stools.
Like little rocks.
Exactly, or just very large, hard stools that are clearly difficult or painful for your baby to pass. They might strain excessively, cry, seem really uncomfortable. A bit of straining or grunting, especially in younger babies learning the mechanics, can be normal, but true constipation involves hard poop and discomfort.
Okay, hard pebbles and pain equals constipation. What causes it when starting solids?
Often it's a shift in diet. Maybe not quite enough fluid intake as solids increase, sometimes not enough fiber, although too much fiber too quickly can also cause issues initially. Or just their gut bacteria adjusting to the new foods.
Are there foods that can help get things moving?
Yes, the famous pea fruits are often helpful. Pears, prunes, plums, peaches too. Offer the fruit itself, pureed or mashed. Other high-fiber foods like sweet potatoes, broccoli, beans, lentils, whole grain cereals like oatmeal, avocado, these can help too. And make sure they're still getting enough fluids, water offered with meals, plus their usual milk feeds.
Pea fruits. Easy to remember. What about prune juice?
Generally, juice isn't recommended for babies under 1, as we said. Water is better for hydration. If constipation is persistent, your doctor might suggest a tiny amount of diluted prune juice, but check with them first. Don't just start giving juice regularly.
Okay, check with the doctor. When should I definitely call them about constipation?
If your baby is constipated and seems unwell, like they're vomiting, have a fever, their belly seems swollen or hard, they're refusing to eat, or seem unusually lethargic or irritable, or if the constipation lasts for more than a week or 2 despite trying dietary changes.
Right, and the opposite end, diarrhea, what does that look like?
Diarrhea would be significantly looser, more watery stools than their new solids normal. Often more frequent too, maybe 3 or more loose watery poops in a row. It might contain mucus sometimes. If it lasts more than 24 hours or baby seems dehydrated, definitely call the doctor.
Okay, so bottom line for poop. Expect changes. Focus on soft consistency and baby's comfort. Know the warning sign colors, and don't panic about frequency alone.
You got it. Poop is just another way your baby's body is communicating how it's handling these new foods.
Good perspective. Let's move to nutrients. Iron. I know this is a big one for babies. Why is it so important around the time solids start?
Iron is absolutely critical for growth and especially brain development. Babies are born with iron stores they get from mom during pregnancy, but these stores start to deplete around 4 to 6 months of age.
Ah, so their built-in supply runs low.
Exactly. And breast milk, while amazing for many things, is actually quite low in iron. Formula is usually iron fortified, but for breastfed babies especially, getting iron from solid foods becomes really crucial around that 6-month mark.
Okay, so we need to focus on iron-rich foods. What are some good ones for babies starting solids?
Meat is a great source. Pureed beef, Lamb, chicken, turkey, iron-fortified infant cereals like oatmeal are specifically designed for this. Well-cooked egg yolk has iron. Lentils, beans, tofu are good plant-based sources. Even some dark green leafy veggies like spinach contain iron, though it's less easily absorbed than from meat.
You mentioned absorption. Is there a trick to helping them absorb the iron better?
Yes, vitamin C is iron's best friend. Pairing iron-rich foods with foods high in vitamin C significantly boosts iron absorption.
Like what pairings?
So you could offer some pureed strawberries or cantaloupe, both high in C, alongside iron-fortified cereal, or mix some pureed red bell pepper, loads of C, into lentils or meat puree. Serve a little citrus fruit with an egg yolk. Simple combinations like that can make a big difference.
That's a fantastic practical tip. Pair iron with C. How much iron do they actually need? Is it something I need to track obsessively?
For babies 7-12 months, the recommendation is about 11 milligrams per day. It sounds like a lot, but you don't necessarily need to count milligrams. The goal is to consistently offer iron-rich foods at most meals and snacks throughout the day. Focus on variety and inclusion.
So offer iron foods regularly. Can they get too much iron from food?
It's generally very difficult for a baby to get too much iron just from food sources. Iron toxicity is usually related to accidental ingestion of supplements. So focus on food sources, pair with vitamin C, and unless your pediatrician has specific concerns about deficiency and recommends a supplement, food is the way to go.
Okay, good to know. Focus on food. One last big question, and it's one I know keeps parents up at night, sometimes literally, sleep. Does starting solids help babies sleep through the night? Please say yes.
Oh, the million-dollar question.
Yeah.
Wish I could give a definitive yes, but the evidence really suggests that starting solids is not a magic sleep solution.
Oh, really? No magic bullet.
Sadly, no. It's a really common belief, maybe passed down through generations, but research doesn't consistently back it up. While severe hunger can disrupt sleep, simply adding solids, especially early on, doesn't guarantee longer stretches of sleep.
So piling in extra cereal before bed won't necessarily work?
Probably not. And it might even displace the milk feeds, which should still be their primary source of calories and nutrients in the first year. Good sleep is much more complex than just having a full tummy of solids.
Okay, so if solids aren't the answer, what does help with sleep then? Briefly.
It's really about the bigger picture. Things like an age-appropriate daytime schedule, enough naps, but not too much day sleep, a consistent, calming bedtime routine, a great sleep environment, dark, quiet, cool.
The usual sleep hygiene stuff.
Exactly. And crucially, the baby's ability to fall asleep independently. If they rely on feeding or rocking to sleep at bedtime, they'll likely need that same help when they naturally wake between sleep cycles overnight. Making sure they get enough calories during the day, mostly from milk, is important too, to rule out genuine night hunger or reverse cycling.
So focus on sleep skills and overall routine, not just solids for sleep.
Precisely. Solids are for nutrition, exploration, and learning eating skills. Sleep needs its own strategies.
That's a really important clarification. Takes the pressure off solids to fix everything. Well, this has been incredibly enlightening. Seriously, so much practical information packed in here for a new mom navigating this.
I hope it feels helpful. The biggest takeaway, truly, is that this is a journey. Every baby is different. Trust your gut, follow your baby's lead, but use these expert guidelines as your map.
Yeah. So, quick recap. Watch for those readiness signs around 6 months. Introduce lots of different foods and textures over time. Definitely prioritize introducing those common allergens early and regularly, one by one.
Uh-huh. Don't freak out about poop changes. Just know it's normal and what's not. Understand the different feeding styles, BLW or purees or a mix are all valid. Find what works for you and your baby.
And remember, iron is important. Pair it with vitamin C. And solids probably won't magically fix sleep.
You nailed it. And keep learning. Talk to your pediatrician. They know your baby best. Look up resources like the SEA website for allergy info in Australia or similar allergy organizations in your country and reputable baby feeding sites.
Perfect. Okay, so as you, the listener, step into this messy, fun, exciting world of solids, just remember you've got this. And maybe a fun thought to leave you with. What first food are you most excited for your little one to try? It's the start of a whole delicious adventure. We're cheering you on.